Hey boot campers, welcome back to another video. This is David, your guide to gastroenterology, and today we're going to be finishing up our gastroenterology anatomy chapter with a discussion of femoral hernias. So femoral hernias are our final set of hernias, and they're unique in a few different ways. We're going to start off by discussing where exactly our femoral anatomy is going to pass through. So we have something called our femoral triangle, and this femoral triangle is a subfascial space in our anterior thigh, and this subfascial space is what's going to contain our femoral sheath, which is a fascial tube beneath the inguinal ligament. Now, when we're thinking about our femoral anatomy, we're largely going to be thinking about our femoral sheath, and that is what you will hear referenced for the most part. However, importantly, while our artery, vein, and lymphatics all travel through our femoral sheath, our femoral nerve does not. So let's highlight these structures very briefly and go over a little mnemonic to remember their order, because that is important. So our femoral nerve is what we'll highlight here first. It's this nice big spaghetti looking yellow line, followed by our femoral artery, which is this nice big red one right here. And then in blue, we'll highlight our femoral vein, which is going to run right next to our femoral artery. And then we're going to highlight our lymphatics, which is this final kind of hard to see portion right here. And it's important to remember what order these are in, and also very easy to remember. So as we move this way, we're going to have our nerve, our artery, our vein, and our lymphatics, which of course spells out navel. And so we're thinking about navel, our umbilicus. As we move this way towards our umbilicus, we're going to spell out navel, and that is the order in which these appear. Now that we're done talking about our gross anatomy, let's talk about the femoral canal. Our femoral canal, much like our inguinal canal, is going to be an area through which our intestines herniate. And the opening to that is called our femoral ring. So this femoral ring right here is the beginning of our femoral canal, and it has a few important landmark borders. So our anterior border for our femoral canal is going to be the floor of our inguinal canal, which is going to be our inguinal ligament. Meanwhile, the lateral border of our femoral canal is going to be our femoral vein, which should give you an idea of where in relation to the femoral artery and nerve this femoral canal is going to be traveling. And then our medial border is going to be the lacunar ligament, which is a small ligament that connects our inguinal ligament to our pectineal ligament. And this is going to be our medial border, with our posterior border being formed not only by the pectineus, but also by the superior ramus of the pubis itself. So with those landmarks established, you should now have a good idea of where exactly this femoral canal is. So now let's get into the presentation of a femoral hernia, which is going to be extremely high yield. Unlike our inguinal hernias, which are going to appear in the groin or scrotum, our femoral hernia is going to appear as a lump that is inferolateral to the pubic tubercle, so down and to the side of our pubic tubercle. And importantly, this is something that is more common in women than it is in men. I like to remember this by thinking of the fem in femoral hernia and the fem in female. So more common in women than in men, and this is the only type of hernia for which that is the case. Finally, the super high yield point about femoral hernias is their very high risk for strangulation and incarceration. This is high yield stuff right here. If they ask you a question about which hernia is most likely to be incarcerated, meaning trapped and unable to be returned back into the body, or strangulated, meaning it has its blood supply cut off and is thus at risk for ischemia and necrosis, this is going to be our femoral hernia. And I want you to think for a second about why that might be. We have this tiny little femoral canal right here, and through that our intestines are going to be pushed. Now, unlike our inguinal canal, which is fairly forgiving, this is a very tight and rigid space, and as such, when our intestines are pushed through here, they have a lot less leeway and are more likely to be trapped or incarcerated, then develop edema, and then finally be swollen to the point that they become strangulated. As I mentioned, this is more common in women than in men, and part of the reason for that is that women have a wider pelvis biologically, which is going to increase the ability of the intestines to come through this femoral canal in the first place. That's it for this video. I hope you all enjoyed this chapter, and I'll see you in the next one.